Now let's begin with the final section of our lecture, and in this section we will talk about the antenatal and palliative care. In this way, when we will talk about antenatal and palliative care, the most important we should know is the antenatal counseling, and then breastfeeding and medications, and what's the relationship between the medications and breastfeeding, and what's the palliative care of the neonate. So first, antenatal counseling pattern is tailored to individuals. So depending on each individual case, antenatal counseling should be performed according to that. Survival 20% to 95%, so it's a big range of survival from 20 to 95%. So whatever is the outcome of the pregnancy, that's a period of too much stress on the mother and on the whole family, and especially if they are at risk of prematurity, or if they have some complications that can lead to prematurity. So depending on the survival rate of 20 to 95%, each patient should have antenatal counseling done. After survival, going back home, cranial ultrasound scans should be performed to find out to look for the assessment of the baby and condition of the involvement of the brain. Problems like necrotizing enterocolitis, then we have retinopathy of prematurity, infections, all these should be followed up properly after the discharge and after survival. Various outcomes, some disabled, some attending mainstream school. So the outcomes are different of these newborn babies. If some of them are totally fine and they attend the regular normal schools and they don't have any disabilities, any learning problem, any communication problems, but some of them have disabilities, and depending on each individual case, their follow-up and their management should be done accordingly. Outcomes of conditions in fetal medicine units can be high drops. We have congenital diaphragmatic hernia can occur, then twin to twin transfusion syndrome, gastroschisis, pulmonary hypoplasia, preterm premature rupture of membranes, and also spina bifida, which is can cause paralysis, hydrocephalus, urinary and fecal incontinence. So all these are different outcomes of conditions that can occur in the fetal medical unit. High drops is the presence of fluid and in the brain or different organs of the body. Diaphragmatic hernia is opening in the diaphragm. Diaphragm is the major muscle of respiration that separates the chest from the abdomen. So hernia of the diaphragm cause bulging of the abdominal contents into the chest or mediastinum. If there is twin pregnancy, then twin to twin transfusion can also occur. And then gastroschisis, if the again opening in the abdominal wall with the bulging of the intestine. Pulmonary hypoplasia. This, if you see in this diagram, the lungs are not fully grown, so there is hypoplasia of the lungs. They have different complications associated with that. Spina bifida is the bulging of the spinal cord out of the opening, so this can also cause different complication. So all these are different outcomes of the neonates in the neonatal units or different pediatric medical units. Breastfeeding and medication. Antenatal risk assessment and surveillance. Lot of medications which are used by the mother, they can go into the breast milk and can damage or affect the fetus. So during the breastfeeding time, it's very important that all the medicines that are safe for the baby, they should be used. Assessment components, maternal need, likelihood of drugs reaching neonatal circulation, and implications for management. Social context. So all these are important depending on the requirement of the medicine for the mother, how important they are and how dangerous they can be for the baby, and we should weigh the benefit and the dangers of the feeding. So this is all performed and is proper assessment should be done. Contraindicated medicines in breastfeeding, usually which are cytotoxic agents and radioactive medicines, they are contraindicated strictly if the mother is breastfeeding. Palliative care, fetal medicine services, counseling, short-term labor managed as at labor site. Parallel planning. Palliative care is important, especially parallel planning. If one method is failed, we should have a planning what to do in the next step or what to do next. That should be done in the palliative care. Trade-offs between type of birth. We should have idea of trade-offs. If one method of delivery is not successful or it's not possible, then we should have the switching available from the normal or from the forceps delivery to the C-section. So we should have a plan for all these managements. Organ transplantation, postnatal investigations, and then we should have perinatal hospices, shared working planning. Perinatal hospices are the places where the babies who do not have the chance of survival, they are kept and they are managed accordingly. And then documentation and follow-up is important for each step and each measurement that is taken for the patient. So this was all about our lecture, the neonate, and we talked in detail about all the different conditions, complications, and the management that can be done in the neonatal period. So thank you for watching sqadia.com.